The SunMed TrachVac Subglottic suction tube is a sterile, single-use device. Prior to use, assemble the equipment required for subglottic suctioning. Use a suction regulator and canister specifically dedicated to the TrachVac endotracheal tube. Assemble the regulator and canister. Position the canister below or equal to the patient level. Connect the suction tubing to the canister. Label the tubing for subglottic suction only. Inspect the package for any sterile seal damage. Using aseptic technique, remove the device from the package. An evacuation port and lumen in the dorsal wall of the tube and proximal to the cuff allows for evacuation of subglottic secretions. The evacuation line is easily identified by the yellow cap. The flex tip, a soft, flexible tip that glides through airway anatomy, reduces the incidence of airway trauma. The dual Murphy eyes at the distal end of the tube prevents occlusion of the distal end of the endotracheal tube. The TrachVac tube is available with high volume and low pressure PVC or polyurethane cuffs. Inflate the pilot balloon and cuff to test for integrity. To inflate the cuff, connect an air-filled syringe to the inflation line and introduce enough air to completely inflate the cuff. Completely remove air from the cuff, pilot balloon, and valve. Prior to intubation, lubricate the external surface of the tip and cuff with a sterile, water-soluble surgical lubricant. If cutting the endotracheal tube is desired, remove the connector and cut the tube at a slight angle to assist reinsertion of the connector. Assure the connector is firmly seated before use. Follow accepted medical techniques for intubation. Be sure to verify that the device has been properly placed in the trachea and not the esophagus or mainstem bronchus. If desired, a stylet or introducer can be used to aid in intubation. After the patient is intubated, connect an air-filled syringe to the inflation line. Inflate the cuff to provide an effective seal at the desired lung inflation pressure or minimal leak technique. Verify tube placement per standard protocol. After cuff inflation, remove the syringe from the valve and assure the check valve is closed and that the cuff does not deflate. Check cuff pressure daily and maintain pressure between 20 and 30 centimeters of water to avoid inadvertent mobilization and under or overinflation of the cuff. Connect the TrachVac endotracheal tube to the breathing circuit. Secure the endotracheal tube in place per facility's intubation protocol. Pinch or occlude the suction tubing and adjust to desired suction pressure. For continuous suction, set a pressure of -20 to -40 millimeters of mercury, or intermittent suction of -100 to -150 millimeters of mercury. Connect the suctioning tubing to the subglottic evacuation line, the line with the yellow connector. Recheck the pressure displayed on the suction regulator and adjust if needed. To ensure suction is working, check for fluid movement in the subglottic evacuation line. Periodically check the evacuation line for blockages. If a blockage is suspected, clear the lumen using a syringe to administer a 3 to 5 cc bolus of air into the evacuation line. Suction the subglottic secretions using a high suction pressure, 120 to 150 millimeters of mercury for 10 to 15 seconds. Repeat the procedure 2 or 3 times until secretions are removed. Use the minimum suction pressure required to effectively remove secretions. For continuous suction, -20 to -40 millimeters of mercury may be used. For intermittent suction, set the suction pressure at -100 to -150 millimeters of mercury and apply suction for 10 to 15 seconds. Follow your facility's subglottic suction protocol. Prior to extubation, thoroughly suction the patient's oral cavity and suction the endotracheal tube. Deflate the cuff by attaching a syringe to the valve and remove the air until a vacuum is detected in the syringe and the pilot balloon has been deflated. Extubate the patient following standard extubation techniques. Discard the endotracheal tube in accordance with accepted medical standards for disposal of biomedical waste.